The pathway is a series of questions that ask women around their mental health.
Ultimately, it provides a framework that the lady will become familiar with over the antenatal and perinatal period.
Your mental health is as important as your physical health, and it's an area that's often forgotten about.
I think for the client it offers continuity of care really.
Hopefully over time this will break down barriers. Women are more likely now to come forward and discuss emotions with the health professionals.
It gives me more confidence as a person and as a professional to know that I'm delivering a continuity of service.
People didn't talk about antenatal and postnatal depression. Antenatal depression was something that really we didn't acknowledge existed particularly.
I think it's useful because I think it's not always an area that people want to talk about. It's quite a sensitive area, so it allows both staff and clients to acknowledge that it's a really important area that we need to concentrate on and that we should be asking these questions because they are really, really important.
It became very evident that midwives had a very low confidence in asking women around mental health and around what had happened previously to them being pregnant. So we needed a process and some education and training to improve that and to improve the confidence of midwives and health visitors in terms of looking at perinatal mental health. The pathway is a series of questions. So every pregnant woman is asked questions around mental health at their first appointment with the midwife. So from the very beginning of pregnancy, they're asked certain questions about previous mental health problems, and then they're asked what we call detection questions around looking at have they got any mental health problems at the time when they're seen. That then continues throughout their pregnancy into health visiting. If a woman is known to have a mental health problem but is well, we can actually refer into mental health services in pregnancy, and work can be done around prevention rather than waiting for a mental health crisis to occur. So with the three groups working in partnership, women have much better outcomes in terms of if they've had previous mental health problems. Midwives now have training with health visitors, so they have a joint network of training which actually improves contact liaison and understanding of each other's roles. And we also then embed the questions from pregnancy right the way through to the woman's first postnatal year.
We get a copy of the booking in form and the pathway. What we do then is we triage that information to see who is the most appropriate person to visit, and if we need to visit earlier, if there's some information that we feel we need to go and do an assessment sooner. So we triage that information, allocate it to a key worker and arrange an antenatal contact.
Initially I first see the ladies with regards to the pathway antenatally, so round about 35-37 weeks pregnancy I will see the ladies within the home and continue the pathway from our midwifery colleagues.
You rung up this morning and you said that you'd like to just have a chat about things, is that right?
Yeah.
Yeah, okay. So what kind of things are you wanting to chat about, Claire?
Well, my husband and my mum have asked me to see you because they don't think I'm coping so well at the moment.
Following a year after the care pathway was introduced and women had been asked the questions for a year, we actually asked women what they felt about being asked around mental health, and women actually liked the fact that we took time to talk about their emotional well-being, that we didn't just concentrate on the physical, that we actually were there to ask them around their feelings in pregnancy and the postnatal period. So hopefully over time this will break down barriers, and it will benefit women because they know that midwives and health visitors are the people to talk to if they've got any mental health problems.
You know how every now and again we ask you some questions about how you're feeling? Is it all right if we do that now?
Yeah.
Okay. So in this last 4 weeks, Claire, have you been bothered by feeling down, depressed or hopeless?
If you make the lady feel at ease, then you're more likely to get the answers that you want. At the end of the day, we're wanting to try and support that lady as much as possible, so we need the right answers. We need to make that lady feel at ease and comfortable.
The perinatal mental health pathway has been a success in terms of the fact that we've now got midwives and health visitors asking the same questions. They have a consistent approach which overall benefits women, and we know this benefits women because women are more likely now to come forward and discuss emotions with the health professionals.